for everyone under a plan by the Pharmacy Guild of Australia. Now, the proposal calls for an urgent shift to a pharmacy-first approach to relieve pressure on overstretched GPs and hospitals.
Now, it comes as new research shows more than half of the population are unaware their local pharmacists can treat common conditions, prescribe certain prescription medicines and issue medical certificates for short-term illnesses. And for more, Professor Trent Twomey, National President of the Pharmacy Guild of Australia, joins us live in Hobart this morning. Good morning to you, Trent. Talk us through this, because there is a little bit of confusion around this, but what are some of the common medications that pharmacists can actually prescribe?
Well, morning, David. Morning, Nat. Happy World Pharmacists Day to all of the Aussie pharmacists and pharmacy assistants today. And you're right. We have over 52,000 hours in our national emergency departments, over 6.5 million GP visits that could be seen by a pharmacist in your local community pharmacy. So if you've got an earache, if you're suffering with asthma, if you need your hormonal contraception, if you've got dermatitis or eczema, or you need a medical certificate because you or one of your loved ones in your family are sick, you can ask your pharmacist at over 6,000 access points nationwide. And that's our message today.
So your message is really go to your pharmacist before your GP and stop clogging up the system.
Well, we all love our GPs. Every Aussie deserves to have a local family doctor that they can have an annual checkup with. But Nat, if we can move some of those common everyday health conditions from general practice and our emergency departments to community pharmacy, it means when we really need a GP, when we really need urgent care in an emergency department, we don't have to wait 3 weeks to see the GP or 3 hours in the ED. And that's exactly what we're saying. So, go to findapharmacy.com.au, and we're open earlier, later and longer. So most GPs shut about 5 o'clock during the weekdays. We shut at about 8 p.m. And most pharmacies, in fact, over half of us are open on Saturdays and Sundays as well. So it's just not something that is usually at the forefront of Aussies' minds when they're not feeling well or someone in their family needs a help.
Yeah, it is a brilliant strategy to relieve that pressure on our hospitals. Trent, thanks for your time this morning and happy National Pharmacist Day.
Yep.
Thanks, mate. Thanks, Nat.
Well, still to come.